is Mildred Hughes. She is our patient on the 5th floor in the cardiac intensive care unit, and we're doing our concept map on you. And one of the first questions we want an answer to is if you could tell us what your current diagnosis is, what the doctors have told you about your current diagnosis.
I have congestive heart failure.
Okay.
And it's really in the last stages.
Okay.
So they want to give me the LVAD. At first it was a heart and kidney transplant, but because my white cells are so low, which they've been low all my life, I've told them that, and they realize now, but they're saying maybe this will be a bridge to the transplant.
Okay.
Build me up so that eventually I can have the transplant.
Exactly, because that is how the LVAD works.
Right.
Sometimes it can, like you said, it can pick your levels up to a place where it's safe to actually do a heart transplant.
Right.
So we'll have our fingers crossed for that.
Yes.
Okay, so now that we know that about your congestive heart failure, before you were diagnosed with anything, what was your life like?
I had a good life.
Yeah.
As a paralegal, I lived a full life. I traveled. I have children and grandchildren. I just did what most single women do, I guess. I've lived my life.
Okay.
And I guess that's why I'm taking this all in stride. I've done everything, so there's nothing I want to really say I haven't done.
Right.
I've done it. So let's move on.
Good for you. And when you first started to get ill, what were some of the symptoms you had? What
I'll
changed?
tell you, in 2005, I had 2 brain aneurysms that were found.
Okay.
These are the third ones that I've had.
Okay.
And when they did the surgery, Dr. Rosenwasser did the surgery, I thought it's strange that I developed this cough.
Okay.
And I thought the cough was related to the surgery. But come to find out, Jefferson diagnosed me with congestive heart failure. And I didn't believe them.
Okay.
I got transferred to Hahnemann, where my original heart doctor was. Because I didn't have a heart doctor here at first. And I said to him, Jefferson's diagnosing me with congestive heart failure. He said, get transferred and come on over here. And I went over there in the ambulance, and he did all the tests and everything. And he said, Millie, they're right. I was floored. I had never heard of it.
Right.
It doesn't run in the family.
Okay.
And I'm
that
going, where
questions.
did I get this from, know? But earlier I had valve replacement and repair.
Okay.
But no one told me that this leads to congestive heart. So I thought once they did the fixing up with the valves, I was good to go.
You were good to go.
I was good to go. Come to find out, no.
Okay.
Yeah.
So we noticed in your chart it says that you have cardiomyopathy,
Yes.
which that's why you had the valve replacements done
Yes.
in the first place.
Yes.
And then that has led to the problem
Yes.
with the mitral valve and all the other.
Yes.
Okay. What kind of lifestyle changes did you have to make when you were diagnosed with the congestive heart failure?
It was a lot. I don't think at first I accepted it.
Right.
Because I didn't know anything about it, and I kept thinking, well, if I feel well, the cough would go away eventually. And I said, well, if I feel well, I'm not the one to sit back on the couch and worry about anything, pity pat myself.
Right.
That's not me. I keep on living, keep going.
Right.
And that's exactly what I did.
Right.
And they kept saying to me, you don't know how sick you are. And I'm going, no, maybe it was a blessing I didn't. Because I wouldn't be smiling at you now if I had accepted and said, oh, I'm going to die or this is going to happen.
Right.
I just kept right on going my normal pace.
Yeah. That's why you're so amazing.
Yeah.
For sure. For sure. As far as the doctor's orders, like medications, diet changes and stuff, was it hard to be compliant with those things?
It was, because they put me on, I think I was taking 13, 14 pills a day.
Okay.
No low sodium, if any at all. That was an adjustment, because when you're Afro-American, you're used to cooking with all the ingredients that you're not supposed to have, right? Because you're raised up on them.
Right.
And it was hard to get away. Chicken didn't taste like chicken, and turkey didn't taste like turkey.
Sure.
But I did the best I could with it.
Right.
Yeah.
Okay. How about after you were first diagnosed, were you able to work, or you were already retired by that point?
I had a ruptured brain aneurysm in '89 that left me permanently disabled.
Okay, very good. Okay. All right, that was the other question. Okay, so since you were disabled, the next question I guess you saw on our list was about your insurance. Today it's tough with a lot of people. I know even my boys have no insurance. They get sick. They're in a world of trouble.
Right.
So your insurance from being a paralegal has helped you with the care and the treatment and the medications that you need to take.
And then by being permanently disabled, you get Medicare.
Okay.
And then with Medicare, I applied to medical assistance, so I have Medicaid.
Okay.
So
So it's sufficient.
Well.
It's sufficient. Very good. It's one less thing for you to worry
Right,
about.
exactly.
Right, okay. I also noticed in your chart that it said you haven't had cigarettes or had a drink in, was that 26 years?
26 years when I got pregnant with my baby girl.
Oh, how about it?
I was 36 and I was like, no way. No way.
Right.
And I said, if I'm going to have this baby, it's going to be healthy.
Right.
Stop smoking, stop drinking.
And
I cold turkey.
And never looked back.
Never
and
looked back.
before you stopped, how much did you smoke?
A packet lasted me a week. I was a social smoker.
Okay. Yeah. A social drinker as well?
And a social drinker, right.
Okay. And you already answered the next question, which was, does heart disease or kidney disease run in your family? And you said no.
No, I'm the first.
Okay. Let's see. Okay, so aside from the exacerbations, which you've had on and off, because we can see in your chart, you've been in and out of Jefferson since 2005.
Right, right.
Not a lot, but quite a few times.
Quite a few times, yeah.
How about, except for when it's acting up, your ability to perform your daily activities, you know?
I'm
you're
finding
okay with
out that in the beginning it was okay, but slowly I'm deteriorating. I don't have the energy that I used to have, and it wasn't until it actually hit me that things aren't the way they used to be that I started saying, well, I am sick.
Right.
You know, something is definitely wrong, and I want it fixed.
Okay.
Yeah.
And so you mentioned earlier you have 2 daughters.
Yes, I have 2 daughters.
And you've told us, and we'll let the people that are going to be watching know, you have the one that's 47, is that right?
One's 48, and the other one's 26.
26. And
yes.
are they able to help you support, not
yes.
financially, but
yes.
emotionally?
Yes, they are.
They're a big source of support for you. Okay. And they know everything about your current condition.
Yes, I think the baby girl's in denial.
Yeah, you said
But the
that.
older one works for medical, so she's in a geriatric clinic helping patients, so she's more aware than the baby girl is.
Okay,
yeah.
okay. And what do you do to handle the emotional part of being ill?
Pray.
Pray.
My faith is what sustains me.
Good for you.
And I believe in God, and He's always there, you know. And a lot of times I look back and go, well, Father, I don't see your footprints behind me. And some can say, because I'm carrying you.
Yeah. Yeah.
You know.
Yeah.
And I said, that's true.
There you go.
That's true.
Good for you. So we did talk about your current diagnosis, your end-stage CHF. And they did obviously come in and talk to you about the LVAD. They explained all of that. So what do you understand the LVAD's going to be doing for you? How does that...
It's a pump to help the heart function correctly.
Right.
Right.
Yeah.
I had never heard of it before.
Yeah.
And I said, what is an L? And then when I saw it, that's going to my chest along the defibrillator. And
right.
Oh, there's not much room in there now because I've lost so much weight, but I guess I'll squeeze it in some kind of way.
It is amazing. And we did
say
say earlier, too, that we're hoping that that's a bridge to a transplant for you, which would be just amazing. So basically that's what the doctors have told you as far as transplants for the heart and the kidney is it really hinges on what's going on with the LVAD. If that changes these other situations, then that's still a possibility for you, which would be great.
Yes.
And let's say you already talked to me yesterday about support at home, because having the LVAD is a big deal.
24 hours
it's
support.
24 hours support.
7 days a week. Yes.
Exactly.
It's a big adjustment when you're used to being independent.
Yeah.
It's a big adjustment.
Yeah, to have to ask for help and it be round the clock.
Yes, yes.
But you're going to do it, right?
Oh, yes, I am.
Yes, you are, with a smile on your face, right?
Oh, yeah.
Okay. Well, that was the end of our serious questions.
Okay.
I think, and we're obviously going to add a little bit that we're going to put our assessment information in so they know what's going on with all that. But one of the lighter note questions we had for you was, if you met someone in a similar situation, what words of advice would you have for them?
I would say to them, have no regrets, move forward, and pray.
Good for you. Make me cry.
Don't you dare.
Who is a source of inspiration to you?
There's always someone worse off than you. Although you may not believe it until you actually see it. Because you think, oh my God, how did I get like this? But there's always someone that's worse off than you. And it's when I hear about those people or see those people, like I'm an inspiration to somebody.
Yeah, you are.
There's somebody out there that's an inspiration. And when I see them, I go, oh dear God, and I'm complaining.
Right.
You know, like little babies that are sick or something like that. Or you see on TV, little child has cancer or a brain tumor or something. Right. And I go, Lord, and I'm 62 and I'm complaining, and that poor little child's to go through that.
Right.
That's my inspiration.
That's your inspiration.
Yeah.
That's beautiful. Okay. What's your favorite song?
Whom Shall I Fear?
Whom Shall I Fear?
Yes.
Okay.
And He didn't bring me this far to leave me.
is far to leave me. Okay, how about your favorite movie?
My favorite movie? I would say Greatest Story Ever Told.
Okay. All right. And the last question we have is, what impact, if any, have the Jefferson nurses and nursing students had on your stay here at Jefferson?
Great impact. Because when you have happy, loving people around you, it makes you stronger. When they go that extra mile, it makes a difference. They're not my students. I call my students because they're all my girls, and boys. But they come in and they're willing to help you. And it's not to do a job. It's whatever you need. You know, I've had them come in before they go home.
Right.
Miss Hughes, you need anything? You know. And to me, that's $1 million right there.
Right.
You know, and that is why I stay here.
Right.
I could have went somewhere else.
Right.
But it's because of the care
That's
that
good.
I'm getting here.
That's good.
That keeps me right here. Because
Very
I
good.
know going and coming, they're going to be there.
Oh yeah,
Yeah.
Unfortunately, looking forward to your
I
coming
know,
too.
right.
You know, you don't.
Okay.
You never want to hear that when you're over the hospital,
exactly.
but it is true.
Yeah.
Well, thank you so much,
You're
Ms.
welcome.
Hughes.
Thank you.
You
And I
know,
hope